Healthcare providers. You're not alone if you're caught off guard or unprepared when a patient talks to you about an interest in medical cannabis.
It's not something we learned a lot about in training. And frankly, it's something that we don't have a lot of medical research on yet. So yes, it's normal to feel a little bit of trepidation when someone asks you about medical cannabis. I'm Matt McIff, and I'm an MD and a qualified medical provider. I work as a family practitioner for Intermountain Health.
And I'm Dallas Hunkin. I'm a medical cannabis pharmacist. I work at Wholesome Co. Cannabis, and will be more than happy to walk you through this.
How should I react when my patient brings up medical cannabis?
It takes a lot of trust for a patient to bring up medical cannabis with their provider. So be careful not to minimize their curiosity, their complaints, or their concerns. It's fine to say what you don't know about medical cannabis. There's a lot that even the most experienced of us don't know. Stay open and non-judgmental. That allows patients to share their experiences and builds trust. Help them find additional resources, like the state's website, medicalcannabis.utah.gov.
Are there legal or professional consequences for helping my patient get a medical cannabis card?
Any Utah-licensed medical practitioner, NP or PA, can certify medical cannabis up to 15 patients as an LMP, or limited medical provider. Therefore, the limited medical provider program does not require certification, and the patient can get a medical card if they have a qualifying condition. But to issue more than 15 cards, you need to become a qualified medical provider and receive additional training and certification. Properly certified medical providers are operating within state law. Patients who obtain a card, purchase products through the approved state system, are also operating within the law.
I know nothing about medical cannabis. How can I start educating myself?
Learning about the endocannabinoid system is a very important part of helping patients to understand how medical cannabis can help them.
A great place to start is the state's medical cannabis website. There you will learn more about qualifying conditions, how cannabis is used, and the law regarding cannabis. You will also learn more about the process for a patient to obtain a medical card. You can point patients here as well to start educating themselves.
They'll also discover some of the different formulations and dosing regimens that could potentially be available. There's also a step-by-step process on, helping your patients better understand where cannabis kind of fits into their treatment plans.
The Utah Center for Medical Cannabis has a provider hotline for any medical or legal question. Within 24 hours, the staff will respond as best they are able.
A provider can always reach a pharmacist via email or via phone, and we're more than happy to help answer any questions or concerns that you might have regarding medical cannabis, as well as treatment plans for patients.
I work with pediatric patients. How are things different for them?
For patients under the age of 21, or for patients who have a condition not on the qualifying list, their case needs to be reviewed by the Compassionate Use Board, or CUB. It's a more involved process, but it can go more smoothly when the QMP and patient provide everything that the CUB asks for.
I have no idea how to prescribe cannabis or help my patient manage their side effects.
So medical cannabis is not like prescription medications. Medical cannabis comes with a lot of nuances where we as pharmacists can help patients and physicians as well better understand how treatment plans, regimens, dosing, and formulations can better help patients to streamline their treatments. So we do ask patients if they have available to bring in their medication lists. We'll review with them any questions or concerns they may have as far as drug interactions with medical cannabis. We can also address any type of concerns, especially when it comes to mental health history. I always encourage patients to continue their regimens with their mood stabilizers because cannabis isn't at a position just yet where it can replace them.
What risks of medical cannabis use should I be aware of?
Start learning about the potential side effects of medical cannabis. A great place to start is the state website.
There are a few negative side effects patients should be aware of: low blood pressure, sleepiness, drowsiness, confusion. And so with that in mind, we definitely like to make patients be aware and to be conscientious of how they use their products as well as when they use their products.
There are risks with driving. One risk of using THC, a component of medical cannabis, is developing physical or psychologic dependence, leading to cannabis use disorder, or CUD. Following up regularly with your healthcare provider or your QMP is the best way to prevent long-term harm. A QMP that issues a medical card can withdraw it at any time. A QMP can also put limits on the type of products and the amount that a patient can buy.
How do I know if medical cannabis will work for my patient?
You won't at first. Cannabis is not just one thing. It's multiple different species and multiple strains and multiple pharmacologically active compounds. You can review the state website about the evidence of efficacy for certain conditions. There's more evidence for some conditions than others, but it's not a cure-all. Other than that, it's a trial and error process. Will it work? Well, it's hard to say, but you and your patient will learn that together.